Hi, I'm Dr. Shashank Dhanuka. I'm a consultant urologist and neurosurgeon with a special interest in the treatment of kidney stones. In today's video, I'll be talking about certain very important and relevant things about kidney stones that you should know. So number one, what are kidney stones? Urine contains many dissolved minerals and salts. When the urine has high levels of these minerals and salts, hard stones can form. These stones can sometimes be silent without being detected, or they can present with an acute pain. There is a delicate balance between the stone dissolving factors and stone forming factors in our urine. When the stone forming factors are more predominant, they result in the formation of stones. What are the different types of kidney stones? Well, kidney stones come in many different types. The way they will be treated depends upon the type of the stone as well as their location. The path to prevent new stones from forming also depends on the stone type. There are four main categories of stones. Number one, calcium stones. These are the most common type of kidney stones, contributing about 80% of the cases. There are two types of calcium stones predominantly, the calcium oxalate stones and the calcium phosphate stones. Some people have too much calcium in the urine, raising their risk of formation of calcium stones. Even with normal amounts of calcium in the urine, these stones can get formed due to certain other metabolic or stone forming factors. Number two, uric acid stones. These are responsible for about 5 to 10% of kidney stones. Having acidic urine increases the risk of formation of uric acid stones. Acidic urine can come from being overweight, having chronic diarrhea, type 2 diabetes, a diet that is high in animal proteins, low in fruits and vegetables, and even the presence of a condition called gout. The third type of stone, which is relatively more common in India, is struvite or infection stones. These stones are related to the occurrence of chronic urinary tract infections, people who get chronic UTIs, or those who have certain neurologic conditions due to which their bladder may not be emptying well enough, are more prone for developing these type of stones. Number four, cystine stones. These are relatively rare, responsible for less than 1% of kidney stones. So cystine is an amino acid that is present in certain foods, and it is one of the building blocks of the protein in the body. When high amounts of cystine are excreted in the urine, they can result in the formation of cystine stones. These usually start from childhood and are related to an inherent anomaly in the metabolism of cystine. What are the symptoms of kidney stones? So as I said earlier, stones in the kidney may not cause any symptoms at all. They may go completely undiagnosed. However, if a stone blocks the flow of urine, it can cause a lot of pain. The symptoms of stones include, most commonly, a sharp cramping pain in the back and side. The location of this pain is usually between the ribs and the hip bone on the back. This pain may move towards the lower abdomen or the groin, which is the classical loin to groin radiation of pain. Men may also feel the pain radiating towards the tip of their penis, and women may have a radiation of the pain towards their labia. A second very commonly seen symptom of kidney stones is an intense urge to urinate or having an increased frequency of urination. Sometimes it may be associated with a burning feeling during urination. There can be the presence of blood in the urine, and this may be fresh red blood or dark altered blood. Stones may also present with an associated nausea and vomiting. How are kidney stones treated? So the treatment of kidney stones depends on the type of the stone, its size, its location, and the presentation of the symptoms. The different treatments and the decision to choose which is most appropriate is best taken by a urologist who specializes in the treatment of kidney stones. The first treatment option is watchful waiting to allow the stone to pass on its own. Often, adequate hydration can help the stone to pass. Smaller stones are more likely to pass on their own. Medical expulsive therapy includes the use of adequate hydration along with certain medications which have shown to improve the chances of spontaneous passage of the stone. Surgery. Surgery can be performed using minimally invasive methods or even the use of shockwave lithotripsy. A shockwave lithotripsy employs a shockwave lithotripter, which is basically a machine that generates shockwaves which are focused on the stone and that helps to break the stone into smaller size, which then spontaneously pass in the urine. Surgery, mostly performed in today's era, is minimally invasive. Under the domain of endourology, there are fantastic minimally invasive endourological approaches with the help of which kidney as well as ureteric stones can be treated. Various energy sources like different types of lasers are being employed regularly in the treatment of stones, and usually the treatment can be completed by a very small incision or no incision at all, utilizing the natural orifice in the urinary tract, and the patient can recover within a day and get back to work within 2 to 3 days. How to prevent kidney stones? Once a person is detected with a kidney stone or has a family history of kidney stones, it should be remembered that their risk of forming more kidney stones is higher than the average population. It has been estimated that for a person with a history of kidney stones, the chances of getting another stone episode in the next 5 years is nearly 50%. Some tips to prevent the formation of kidney stones include: number 1, drink enough fluids each day, more than 3 to 3.5 liters per day, which should ensure a urine output of more than 2.5 liters per day. Number 2, reduce the amount of salt in your diet. Number 3, eat an appropriate amount of calcium and do not restrict your calcium intake. Number 4, decrease the amount of animal protein intake in your diet. Number 5, eat plenty of fruits and vegetables. And number 6, eat foods with low oxalate levels, or in other words, avoid high oxalate foods. Kidney stones are an ever-increasing problem in our country, and the changing lifestyles, the diet, the inadequate hydration, the metabolic factors are all that contribute to the increased incidence of kidney stones. I would encourage everyone to lead a healthy lifestyle, to be aware about their diet and their hydration, and when you do get a stone episode, consult a urologist who specializes in the management of kidney stones. Diagnose the disease early, treat early. Stay healthy. For more relevant and useful health-related talks, do subscribe to my channel, like this video, and share with your family and friends. Thank you.